How are you? Mikey, have we got anyone today, Marty? Okay. Yeah, I'll have to get my mask if we're going to go in. Do we have time? We'll just make a quick call to see if someone's on the way. How are you?
I'm good. How are you?
Very good.
Sitting for a while.
No. You don't get to do these as often.
No, I got
Lights are bright today. Very bright. Oh, well, good morning, Queensland. We wanted to update with school holidays starting tomorrow that we're going to have pop-up clinics over 50 around the state, in addition to our existing clinics like the one here at Kippering on the Redcliffe Peninsula. And the reason why we're setting up these extra clinics is because we are seeing an increase in the number of cases that we have in Queensland. So we haven't hit the peak. We certainly are not coming off that peak yet. What we have seen is we've now got 376 people in our public hospitals with COVID, 13 in ICU and another 27 in private hospitals and 1 in ICU, and reporting 10,722 cases today. So with that, we know that we have seen over the last 2 weeks numbers increasing in our hospitals, but also along our furloughed staff. And I've talked about this earlier this week. As of yesterday, we now have 3,305 health workers and Queensland Ambulance Service workers who are isolating and quarantining. This will put pressure on our health system. It is putting pressure on our health system. So with increasing cases in our hospitals, as well as a very large number, in fact more than doubled in the last week and a half, of staff who are unavailable to work, we are notifying that there will be some localised changes to services. Each hospital and health service, based on their demands, will be looking at whether they need to suspend planned care. That means elective surgery. We are not at this stage looking at having a statewide suspension of elective surgery, and we hope not to need to do that in this current wave. But I do believe it's important that we let people know that in various parts of Queensland right now, we are seeing extra pressure, and those hospitals are moving to Tier 3 and will need to put some measures in place. That includes on the north side of Brisbane here, we are seeing increases in cases again and staff furloughed. On the Gold Coast, Cairns is seeing it again, Darling down, so it's not just isolated to one area of Queensland. But those hospitals that are not seeing as much pressure, I'm pleased to say, will not be needing to put those sorts of measures in place. So all of these numbers, this second wave reinforces the need for people to come out and get their boosters, and our vaccination centres are open. Of course, you can go to a pharmacy and you can go to a GP. We are still only at just over 60%, so 63% of our population have had their boosters. That means we still have a large number of people who are due right now to get their booster and haven't come forward. We know the booster makes a difference, so please come forward. But with the number of cases we're seeing with children, and there's 2,373 children recorded as positive in the last 24 hours, we are asking parents, particularly those with children who are 5 to 11-year-olds, please come forward and take up the opportunity with these pop-up clinics. They'll be at shopping centres, they'll be at attractions, different amusement attractions, and also at schools. These sites are being put up on our website as I speak. They will have the dates and the times that they are available, and as I say, they spread right across the state. So please, if you haven't got your child vaccinated yet, have a look at all the pop-up clinics and our vaccination centres that will be operating over school holidays, and get your child vaccinated now. I'll hand over to the Chief Health Officer now.
Thank you very much, Minister. The current wave of the COVID pandemic is, of course, being driven by the BA2 subvariant. About 2/3 of the isolates of COVID that we are seeing are this BA2 subvariant, and it does seem to be particularly affecting children. That's probably because of the low vaccination rates in children and the relative lack of exposure that children had during that first Omicron wave, the BA1 wave. On a more positive note, our data is suggesting that we are approaching the peak of transmission of this current wave. We're approaching the peak of transmission of this wave, although we will expect that the hospitalisations and the furloughing of staff in various industries lags behind the peak of transmission by a week or two. So hospitalisations will continue to increase probably over the next week or two, but then hopefully begin to fall after that, because we do believe that the transmission peak, we are close to the transmission peak of this virus. But again, even though we may be approaching that peak, the peak, as we've said many times, is not the end. That's halfway through the wave. So it's critical, of course, that people continue to get vaccinated. So if you're eligible for a third dose of that vaccine, get that third dose if for some reason you haven't already had it. On the 4th of April, many people, that is people over the age of 65, Indigenous people over the age of 50, and those with underlying immune disorders will be entitled to a fourth dose of the vaccine. And of course, parents are strongly encouraged to get their children vaccinated immediately if they have not already done so. Now, we are hoping, and the data does look like this wave will be milder than the wave we saw in January, probably about a third of the size of the wave we saw in January, but it's not over yet, and particularly the hospitalisations are not over yet. The reason, of course, that our hospitalisations are not nearly as high as we expected is simply because of vaccination. It really is simple. It's as simple as that. Vaccination has completely transformed this pandemic. So we have 376 people in public hospitals, but interestingly only 13 patients in intensive care and only 4 of those on ventilators, which is a very small number when you consider the size of the state of Queensland. All of that is because of vaccination. There are currently the number of children in hospital has gone up slightly, which is not surprising given how many cases we are seeing in children. There are 21 children in hospital, but the majority of those in children who have tested positive for COVID are in hospital with COVID, not because of COVID. So if a child comes in with a broken arm and happens to have COVID, that will be counted in those statistics. We do the only children that perhaps we do see being admitted to hospital with COVID, we see a number of babies who have fever who are often admitted just to make sure they don't have some other cause for their high fever. And we are still seeing this very rare complication of the multi-system inflammatory disorder. It's not common, but when it happens, it is serious, and we have seen children in intensive care with this complication of COVID-19. I do also want to just emphasise changes to the testing and quarantine requirements for people who've had COVID-19. So these are people who have had documented COVID-19 either by RAT test or PCR. So COVID-19 testing and quarantine requirements for those who have had the virus have been relaxed as part of recent changes to the national guidelines. So Queenslanders who have recovered from COVID-19 will not need to be tested for the virus for at least for 12 weeks. For 12 weeks, regardless of their symptoms. So if you have a cold flu symptoms within 12 weeks of having documented COVID-19, that is not necessary to be retested. Also, they will not be considered a close contact during that 12-week period after having documented COVID-19. So they will not need to quarantine if you have been in the home of someone with COVID-19 after having had COVID-19 yourself for a 12-week period. But once this 12-week period has passed, a person should again be tested if they develop symptoms and abide by close contact arrangements if they meet the relevant definition. Now, we will be very actively reviewing the few remaining public health measures that remain in place, because there's relatively few public health measures in place at the moment in Queensland, as our hospitalisations are expected to fall in the coming weeks. Now, at this stage, we still don't know what will happen in winter. We don't know whether we'll have further waves and how significant they will be, but the pattern so far is as we expected, having had a significant wave in January and what looks like a much smaller, maybe a third of the size wave at present. But we are at the peak of that wave at present, not at the end, it's the peak. So there will be more cases to come in the coming weeks, and we'll expect an increase in hospitalisations probably over the next week or so, because we are at the peak or close to the peak of transmission of the virus in the community.
Dr. Gerard, we're at 92% fully vaccinated, 63% booster shot. At what point are you comfortable allowing unvaccinated people to access hospitality venues?
That's a good question. We're reviewing these at the moment. We decided that given that we have had a second wave, we would just put on hold all the measures until it was clear that this second wave was receding. Our data suggests that the transmission of the virus is approaching that peak, but we want to see the numbers of hospitalisations fall before we look at any of these measures. And hopefully we'll start to see those fall in the next couple of weeks. Now, what exactly we do and what we change then, we'll determine then. But we're going to be reviewing all these measures yet again as these numbers are expected to fall.
Minister, can you jump in? With hotel quarantine, should Queenslanders be frustrated that they're paying an undisclosed amount for Wellcamp, but also the government spending millions of dollars on hotel quarantine at the same time?
Not at all. Wellcamp has actually resulted in us being able to decommission a large number of hotel quarantine in southeast Queensland. In fact, the only one we're still using is Novotel, and it's not a dedicated quarantine hotel. It's mixed use, and it's there if we have emergent circumstances where we need to place someone quickly. But otherwise, the only ones we are now using are in the regions. But since we bought Wellcamp online, it has saved us $8.5 million a month. And when we decommission the remainder of those hotels in the regions, we'll be saving another $5.7 million a month. Hotel quarantine is not cheap, but what we know is that it has saved us millions, if not over $1 billion in economic loss, because the analysis is that a single 1 week lockdown hits our economy by $700 million. So hotel quarantine has saved us from having major outbreaks in this state. It stopped us from having a Delta wave, which we know saved many, many lives. We only need to look at interstate and what happened with that Delta wave that started in June last year in New South Wales. So hotel quarantine has really protected us. Wellcamp is shifting those responsibilities and means that we don't have to incur those costs with hotel quarantine, and it means those hotels now can go back to business as usual and start welcoming all of those tourists, including those international tourists that we hope will come in large numbers into Queensland again.
In Parliament yesterday, you talked about weighing up the risk of public health with the comments of the Human Rights Commissioner. What is the risk of an unvaccinated person going to a hospitality venue?
Well, as we know, there's two elements here. It's encouraging people and giving people the confidence to be able to go out to support the economy, knowing that going into these venues, every single person there is vaccinated. The staff are vaccinated and the patrons are vaccinated. So it's encouraging people to want to actually be active in the community because they can have that confidence that in those areas where we know they've been high risk in the past, there's been cluster outbreaks as a consequence of venues like this. And again, we've seen many examples of that interstate. As opposed to allowing people unvaccinated, which includes workers and patrons, to be in those venues. So, we are still seeing cases. We have another wave. 3,300 health workers right now are not in the workplace because COVID's still spreading throughout the community. So we still need to monitor this closely, hold on to the restrictions, which are so few. As the Chief Health Officer has said, we have the requirement to isolate or quarantine if you're a close contact in relation to positive cases, and we have the mandatory vaccination rule around patrons and workers in certain sectors. That are the only restrictions we have left in Queensland, but it is still doing its job, and we want to see what happens after this wave before we make any decisions to change those. Thanks.
Why did the Premier declare that hotel quarantine was over if it wasn't?
Because we said all along when Wellcamp opens, we will still need to have some facilities around. It is not unreasonable to maintain hotel quarantine in the regions. Surely we don't expect a tourist who's just in the middle of their holiday, finds out they've got COVID, to travel to Wellcamp. So we have hotel quarantine in Cairns. My health service also tells me that people who are homeless, people who do not have anywhere to isolate because they're positive, we don't want them taking up a hospital bed if they don't need it. So we're securing hotel rooms for those, and we've got that in Townsville and Mackay as well. I think Rockhampton as well. So it's more than reasonable we maintain these for the moment in the regions. And as I say, we don't have any more in southeast Queensland where we're using Wellcamp other than Novotel at the airport, which is for emergent circumstances.
I was just going to ask if Wellcamp it was offered for people in northern New South Wales who are suffering from the floods. Has anyone taken up that idea?
I'm not aware. I'd have to check whether any offers. I know we were offering that in southeast Queensland as well. I think it's a great idea. They're fantastic facilities, and I know even in my community people have been left homeless, and we're using hotels. Our local not-for-profit organisations and housing organisations are using local hotels to house people at the moment. There's a limit to those rooms, so I think it's a fantastic way of utilising this facility, and I can see a great use going forward when we have natural disasters and people need quick short-term accommodation, that these facilities can be used. And it's up to New South Wales whether they take up that option and the people of Lismore, but it's there. That's the main thing. We want to reach out a hand of friendship to those who have been impacted. It's devastating to see Lismore hit again, it really is, and so if we can help in any way, it's great that we can.
Dr. Gerard, can I just clarify what you said before? So it appears you are concerned about what might happen in winter, but you said you're also reviewing restrictions regularly. We're only about 2.5 months away from winter, so can you envisage removing restrictions only to then potentially put them back a month later?
I think as a general principle, taking away restrictions, putting them back will be very difficult. So that's why when we take them away, we need to be sure that that is what we want to do. The one exception to that might be masks. It might be relatively easy to reintroduce masks if required. But other restrictions, if we remove them, it will be difficult to put them back. So that's what we want. We are being relatively cautious in our approach.
Is it likely then that you won't make a decision on the larger restrictions, the ones that are more difficult to implement, until after winter?
Oh, we're reviewing them. We really are, honestly are reviewing them constantly. And it's just this Omicron wave we've just put it on hold until this BA2 wave ends, and then we're going to look again at where we go from there.
Thanks, guys.
Cheers.
Thank you.